complication of stroke. The chronic complication of stroke are related to the decubitus, prolonged decubitus. Is it clear? Now the question you have to ask yourself is, what are the different elements involved with prolonged decubitus? The prolonged decubitus, we first have the central nervous system, where you have depression. Is it clear? When you have depression, is going to be an anxiety. Depression and anxiety is involved in after stroke from prolonged decubitus. That's the first system. Second system, cardiovascular system, can have a deep venous thrombosis, and you have pulmonary embolism. Is it clear? The third, we have the respiratory system, where we have pulmonary stasis, and we have aspiration pneumonia. Is it clear? Aspiration pneumonia. And aspiration pneumonia is mostly going to occur in patients that have a problem with swallowing. Is it clear? They can aspirate the fluid coming from the upper respiratory tract. Is it clear? Now, the fourth element after respiratory system, we have the GIT. In the GIT, you can have a fecaloma, and we have constipation. Is it clear? As prolonged decubitus. The fifth element after that, we have inside the urinary system, you can have urinary tract infection. Is it clear? Urinary tract infection, you can have urinary incontinence. Is it clear? You have urinary tract infection, urinary incontinence, particularly a functional incontinence, meaning that the patient does not want to struggle in order for him to wake up from the bed and go out to urinate. Is it clear? So that is a functional incontinence. The next one is the integumentary system, and the integumentary system is going to be bed sores. When you have patient with bed sores or pressure sores, is going to be in the integumentary system. Then we have the musculoskeletal system. In the muscle, you are going to have a proximal amyotrophy. Is it clear? So proximal amyotrophy muscle, for generally the proximal muscles are going to be atrophied. Is it clear? Proximal muscle atrophy or proximal amyotrophy. Is it clear? Now the next one, the musculoskeletal, for the skeletal part, is osteoporosis. Is it clear? So generally, those are the different elements that you can have at the level of the prolonged decubitus. Is it clear? And then you can visualize, provided the patient with stroke has come to you after a very long period of time, you can visualize each of these elements. For depression and anxiety, you need to do a psychological examination, and the psychological examination has 10 steps that I'm going to send to you in the comments. Is it clear? So don't forget to comment that I should send to you the psychological examination. For the deep venous thrombosis, you do a calf tenderness, try to evaluate if it is unilateral leg swelling, try to evaluate for a calf tenderness. Is it clear? And then try to evaluate for the Hoffman sign, or for the Holman sign, sorry. For the pulmonary embolism, the patient is going to present with signs of respiratory distress. He's going to have tachycardia, signs of respiratory distress, and he's going to have lung signs like crackles, like wheezes, even at the level of the chest in pulmonary embolism. Now, the next thing is in pulmonary stasis, you're going to hear crackles, mostly are located at the basal site, or the site toward which the patient is always lying down. If the patient is always lying on the right side, it means that you're going to have crackles on the right side. If the patient is always lying on the left side, you're always going to have crackles on the left side. So where the patient lies, there's going to be crackles or stasis at that location. Is it clear? So in order for you to improve pulmonary stasis, you need to change the position of the patient, and you need to do a chest physiotherapy. For aspiration pneumonia, the patient is going to swallow, has difficulty. You have a patient that has difficulty in swallowing. Is it clear? Have difficulty in swallowing and may have crackles, particularly located in the right side. Is it clear? In the right lower lung field. That is mostly for aspiration pneumonia. Now, for a fecaloma, when you have a fecaloma, you do a DRE in order to visualize for impacted stools, in order to visualize for fecaloma, and then this patient may have a history of constipation. For urinary tract infection, generally the patient is going to tell you that he has dysuria or liguria, and may even go to a point of back pain and fever where the patient has an acute pyelonephritis. And then you have this, we have also bed sores that you have to evaluate in this patient. So all that you do in physical examination to evaluate for the complication of stroke in physical examination. Are you getting? For the muscles, you do muscle examination, the proximal muscles, where you're going to see proximal amyotrophy, and you also evaluate. You cannot evaluate for the bones at the level of physical examination. It's going to be quite difficult. You can only do that on investigation to visualize for osteoporosis with DEXA. DEXA is a test in order to visualize osteoporosis. Is it clear? It's an X-ray, particular X-ray, in order to visualize the osteoporosis. So these are the different elements that you must bring out in a physical examination of a patient with stroke. Is it clear? Now the next part you are going to visualize now is going to be your diagnosis and your diagnosis discussion for a patient with stroke. Thank you.